Hi, I'm Dr. Jack West, medical oncologist from Seattle, Washington, and the founder and president of GRACE. One of the big questions we face with immunotherapy is we have the fortunate situation that a significant minority of our patients are doing well on it for a long period. They may be responding and doing well for 6 months, 9 months, 12 months, or longer. And when we know that the immune system has a memory, that it has the potential to recognize and attack something it's seen before, whether that is cancer or even chickenpox, the question is, can we do just as well by stopping the immune therapy that they're getting every 2 or 3 weeks, or do we actually need to keep it going? Because certainly it adds expense and inconvenience and potentially cumulative side effect risk. So up until this point in the world of lung cancer, we've really relied just on our judgment and patient preferences about whether to stop treatment or not. Certainly some patients need to stop for side effects, but we now finally have some actual evidence to help guide our decision. This comes in the form of a trial called Checkmate 153, which wasn't enormous and was actually designed largely to focus on safety and tolerability issues. But it does provide useful information about differences in efficacy for patients. And it looked at the question of whether in patients who were doing well a year into treatment, you did the same, better, or worse if you kept the treatment going versus whether you stop it at the point of a year into it. Now, this study started with over 1,200 patients enrolled and started on Opdivo or nivolumab, an immune checkpoint inhibitor. And it then ended up with just 220 of those initial group of over 1,200 who went for a year without significant issues with side effects and who had a response or no progression. And then just randomized those patients to either continue on treatment indefinitely or to stop treatment at a fixed duration of a year. Now, as you might expect, one of the other limitations is that this is a commercially available drug, Opdivo, and patients could decide whether they actually wanted to stay on the drug or not. And so it ended up with only a little over 160 who accepted that randomization to either stop or keep going. But that 160 patients or so really gave us a clear indication, more than I would have expected to see, that there is a benefit to staying on continuous treatment. Specifically, the study showed a major improvement in progression-free survival for the patients who continued on treatment compared to those who stopped. It also showed a trend toward a better overall survival, but this wasn't a large study and the differences weren't enough to make it what's called statistically significant. But the difference in magnitude of how people did in terms of the time before the cancer progressed is enough that I would consider this to be an overwhelming difference favoring staying on treatment. The side effects were not significantly different and there were rarely any new side effects in patients who continued on the treatment. And so it's important also to note that just about every subgroup of patients, whether we looked at age or sex or whether they had high or low PD-L1, all of the patient groups that were looked at got the greater degree of benefit from continuing on indefinite treatment in the absence of either prohibitive side effects or clear progression of disease. Now, in the patients who stopped, it did allow for patients to go back on to treatment. And in some cases, patients went weeks. In some cases, patients would go for many months or a year before their cancer relapsed. And in some cases, going back onto the immune therapy led to a good response again for a long period of time, but sometimes not. And so overall, my clear conclusion from this, even though it is not a big study and it was not designed to conclusively answer the question, is that we finally have enough evidence to say that it is better to continue on immunotherapy rather than presume that it's just as good to stop. We may get more information in the future, but right now it's great to go have more information than just our judgment. It's enough for me to change my practice. Thanks.